So let me start by saying that my assumption is that many of us in this room work on a range of infectious disease threats, from localized to regional to global, from slow-moving to fast-moving, acute to chronic, and that's the same with our center in Baltimore. But what we wanted to do this year as one of the facets of our work was to better understand and to begin to talk about and think about global risks that are particularly acute, the most consequential, the most fast-moving, and think about whether there are ways that we could communicate better about them as a group, kind of create a more of a working community around them. And to that end, our group came up with, next slide please, a working definition of the kinds of things that we'd already worked on before, but we not really called by any particular name. And I think many people in this room work on things that might fit in this category. But when we started talking about global catastrophic risks or biological risks, we developed this kind of working definition. It's obviously subject to change, and you all may have different views on what might be in it. But particular elements of it, I think, are in the second set of words, which are, these are risks in our minds that could lead to potential long-lasting damage of governments, international relationships, or societal stability. And many pandemics would fall in this category, but not all. And other kinds of risks might fall in this category as well. Next slide. Why bother with this? Well, in our view, we think that people are working on them, but they're not necessarily calling them out in any particular way. They get mixed in with other things that we do. And we think that, at least for some agencies of government, some institutions, some academic institutions, that this kind of risk is worth paying attention to. First, because of the extraordinary potential consequences. Also, because some of these things might be tractable. We think we could communicate better about them, diminish consequences in practice. And because scientists have taken a leadership role in addressing, calling out, and working on other kinds of global catastrophic risks, not in the biospace, but, for example, in nuclear weapons, climate change, artificial intelligence. Next slide. So for us, it was useful to think about some of the large historical examples and think about, well, what would these examples do? Would these fit into a kind of a working definition of a global catastrophic risk? 1918 is probably the archetype for all of us. We know what it did. We've already heard about it this morning. We all know this by heart. Extreme economic and social disruption. In the end, even with 50 million killed by this disease, the impact on governments was not particularly visible a couple of years later. And the economic damage was not particularly visible over the long run. But if it happened today, or a disease somewhat in that category happened again today, some things would be better, some things might be worse. The way that we travel, the conflicts between countries that have access to medicines and those that don't, the potential impact on absenteeism related to critical infrastructure, government, commerce, air traffic, military. So I don't want to say yes or no, this would be a global catastrophic risk, but we can imagine that there are things about it that are quite worrisome, even though in the old, 100 years ago, it was something that kind of the global economy self-recovered. Next slide. How about H5N1, another example? Obviously, huge global alarm around this problem back in the middle of the last decade. Fast-spreading, epizootic among birds. Fortunately, no sustained human-to-human transmission, but in cases of H5N1 in humans, the case fatality rate was around 50%. So our sense is that if a virus like this evolved naturally to become readily human transmissible, or was deliberately manipulated to become so and then escaped from a lab by accident or on purpose, that this, in fact, would constitute the kind of thing that I talked about in the second slide. A virus with these properties would be efficient, spreading like influenza, but with higher case fatality rate and potentially, in our view, could lead to sustained and perhaps permanent damage to international relationships, governance, societal stability, and security. And the outcomes would depend on extraordinary actions by governments and by international NGOs and by human behavior. Next slide. Smallpox. So something of the past, but we all know that smallpox still exists in laboratories. We now know that smallpox is possible to recreate de novo without living virus. We saw that horsepox was created this year, and it's the process for doing that was published, perhaps lowering the bar to the synthesis of smallpox. So what happens if smallpox comes back? Well, prior to 1977, we started to talk about this in the earlier panel, but prior to 77, when it was eradicated, it had a case fatality rate of 30%. It was killing 2 million people a year before the campaign ended it, and was considered the most feared infectious disease in the world at its time. It killed over 90%, it and possibly other infectious diseases killed over 90% of the inhabitants of the Americas when it was introduced in a very naive population. So in today's world, if it were reintroduced by accident or on purpose, we have a naive population that looks more like the Americas than it does anything else in time. And again, what would the impact be would depend on biopharma and what we did there. It would depend on public health interventions, clinical interventions, wise governance, but I think we don't really know. And it depends on how extensive the introduction was and the initial response to it. Next slide. What about future pandemic pathogens? We've talked about influenza here today. My colleagues and I just finished a report called The Characteristics of Pandemic Pathogens. Amy Shadalja was the first author of that. Spoke to 120 scientists and health officials from around the world, including many people in this room, and tried to distill down the wisdom of that group and the literature that's published on these issues into a set of recommendations and findings. Some of the points that are worth calling out were that a majority of those we spoke to felt that the highest risks for a new pandemic would be a respiratory transmissible RNA virus. You can see the other characteristics there. I won't read them out, but segmented genome, smaller host genome size, zoonotic relationships. Also important to say that there are no perfect rules. There are violations of these rules, including smallpox, which is a DNA virus that replicates in the nucleus. So there are no hard and fast rules. Age 7 and 9 is considered to be, by CDC, the greatest pandemic risk currently. That's probably a view shared by many in this room. And it's important to know that age 7 and 9 has a case fatality rate of 40%, not 1% to 2%, which was the case fatality rate of 1918. When you ask scientists whether they believe these case fatality rates are hard and fast immutable rules, they generally say no. That's not obviously a uniform view. But other people in this discussion have raised the possibility of other transmissible RNA viruses being as important, potentially in the future. And I list some of the other families of viruses that got, or groups of viruses that got notable attention for potential pandemic cause sometime in the future. The transmission characteristics and treatments and vaccination possibilities for other groups of microbes place limits on their pandemic potential. I think we all know of them. But again, this group, many in this group that we spoke to, do not believe that these limits are immutable, and that either deliberate or potentially naturally evolving changes in characteristics could change the calculation in the future, such as Arturo Castoval at Hopkins, one of my colleagues, says that, I think he said that he fears fungi as being one of the most important pandemic threats of the future because the only thing that prevents fungi from becoming pandemic threats is its thermal range. And that thermal range is certainly mutable in science and potentially mutable by nature, but something we don't typically think about. Next slide. My last two slides here. Don't have time really to think about potential deliberate manipulation or biotechnology manipulations to create new pandemic threats, but there are a number of them. I list only a few of them here. I think other people in the room spend time thinking about these things. We can come back to those in discussion perhaps. Next slide. And to the economics of these issues, many very well done studies on pandemics. And I cite a few of them here, including people who are in the room. And I took some general conclusion from each one of these. I'm sure I've butchered them a bit. But very well done, thoughtful economic analyses, and this is 4 out of probably hundreds that look at different elements of pandemic risk. Next slide. I think if you want to then think about, well, what isn't being studied in these particular economic analyses, and you wanted to think about catastrophic biological risks in more depth, I think considering economic studies of pandemics that don't have the canonical case fatality rate of 1918 would be valuable, since we usually, in many cases, we consider that to be the worst case scenario. Studies that take into consideration things beyond lives lost and income lost, so ways to think about societal instability, loss of governance, loss of collapse of industries that could occur with higher case fatality rates, thinking about the reintroduction of smallpox, what would that look like in today's world and the economics of that, and then potentially even take into account lower GDP globally after some period of time after a major shock to the system like this. So I think I'll stop here and take questions. Thanks, Rebecca.